Sexual education, nursing degree. Body changes. How does the body changes? In boys, the body changes in height and musculature increase, birth, down, and penis and testes increase their dimensions. In girls, there is the menstrual cycle, the breasts grow, they have a rounder appearance, and all. Time and characteristics are different in boys and girls. The masculine anatomy. There is the penis, the testicles, the prostate, and the urinary bladder. And this is the feminine anatomy. There is the ovary, the uterus, the urinary bladder, and the vagina. These are the hormones. In boys, there is the androgen, and the most important of it is the testosterone, that is responsible for the production and maturation of the spermatozoa. The man is always fertile. In girls, there is the estrogen that is responsible for the reproduction, and then there is the progesterone that prepares to pregnancy. When it is low, there is the menstrual cycle. Women are fertile only a few days per month. This is the menstrual cycle. The ovary becomes a follicle, and after 2 weeks it becomes an oocyte. Then there is the ovulation. The fertile period is around 15 days after the menstruation, but sometimes it's before and sometimes after, so use the contraceptive. When there is the ovulation, if the spermatozoa enters the ovary, there is the pregnancy. If it doesn't, there is the menstruation. Becoming pregnant is possible also during the menstrual cycle. And now we talk about contraceptives. How to select a contraceptive? They have to be reversible, efficient, acceptable, and not damaging. The interrupted coitus is not an efficient contraceptive. It fails 1 time on 5, and it does not protect from sexually transmitted diseases. The other natural methods are not efficient methods either. There are different contraceptive methods. They can be hormonal or mechanical. The hormonal methods are the pill, the plaster, the vaginal ring, the intrauterine system. And the mechanical are the condom, the coil, and the diaphragm. The pill has an efficacy of 99%. You have to take 1 pill per day, always at the same hour. It can cause vomit and diarrhea. If it does, the efficacy can be compromised. Then there is the plaster that lasts 7 days and the vaginal ring that lasts 3 weeks. The intrauterine system has an efficacy of 99%. It is arranged by the gynecologist. It is safe even in case of vomit and diarrhea. Then there is the coil that releases ions and the diaphragm that separates vagina from cervix. It is placed before every intercourse and it is removed after at least 8 hours. The condom is the only contraceptive able to protect from sexually transmitted diseases. You have to use a new condom for every intercourse. You have to extract the penis from the vagina while it is still erect to prevent the loss of sperm. If there is a reservoir, you have to leave the extremity area to collect sperm. You have to keep the condom far from the light, from the heat, from sharp objects, from stinging objects, and you have to pay attention to the nails. Here you can see how to wear a condom. If you have some allergy, there are also hypoallergenic condoms. Then there is the emergency contraception. For example, the morning after pill that is not abortive, so it does not function if the fecundation happens. You have to take 2 pills within 12 hours and not beyond 72 hours. The efficacy decreases with the passing of time from the intercourse. Then there is the 5 morning after pill. It is known as Ella-1 and it can be bought in pharmacies from all adult women, while minor girls need a prescription, but they can buy it anonymously in every emergency room. The efficacy decreases with the passing of time from the intercourse. There are some places where you can talk about contraception, like the clinics, where you can go to ask for clarifications, request free contraceptives, and request free medical examination. And now we talk about sexually transmitted diseases. Sexually transmitted diseases happen not only with genital relationships, but also with anal and oral sex. They can affect both women and men, and they are frequent before 25 years old. The common symptoms are genital secretions, genital itch, genital burning sensation, and urinary trouble. To protect yourself from sexually transmitted diseases, a good idea is to wash yourself after sex. To prevent sexually transmitted diseases, you have to use condoms. Then there is hepatitis. There are different types of hepatitis: A, B, C, D, E. For hepatitis B, there is a vaccine. If it contracted at young age, it is chronic. It is transmitted sexually and it can be transmitted through infected blood. You have also to pay attention to tattoos and piercings. Then there is the genital herpes. The symptoms are genital injuries like blisters and genital burning sensation. The genital herpes is caused by a virus that is always present in the body system. It can be in a period of latency or inactivity. The transmission can happen even during the inactive period. It is transmitted by genital relationship, kisses, touch, and objects exchange. The infection is possible even from mother to child during the childbirth. Then there is the syphilis. It gives serious problems even a lot of years after the infection. The syphilis develops in 3 phases. In the first phase, the symptoms are little genital injuries, cutaneous eruptions, and fever and fatigue. In the second phase, the symptoms are skin marks, fever, fatigue, and weight loss. Then there is an intermediate phase where there are no symptoms. And then the third phase, where if the disease has not been cured, the damage extends to every organ. The third phase is rare because usually the disease is treated in the first phases. The infection is possible from a mother to child during the childbirth. Then there is the gonorrhea. The symptoms are plentiful genital yellow secretions and genital inflammation. With antibiotics, it can be cured completely. The transmission is possible from hands to other body parts, for example, eyes. The transmission is possible from mother to child during the childbirth. And then the Candida. It is a fungus that is normally present in the body system. It is pathological when the immunitary defenses are low. The therapy is the antifungal. The symptoms are intense itch, genital erythema and swelling, and genital secretions. Then there is chlamydia. The symptoms are yellow secretions, urinary burning sensation, and sometimes there are no symptoms. The sterility is at risk. The infection is possible from mother to child during the childbirth. In vaginal bacterial inflammation, the symptoms are genital yellow and green secretions, intense smell, and no itch, while in parasitic there is a very intense itch. and the transmission is possible through objects exchange, for example, towels. The mononucleosis is also called the kiss disease. It is transmitted with saliva exchange. The symptoms are fever and throat inflammation. And then the AIDS. The AIDS is not transmitted by kisses, touch, hugs, hand grip, tears, feces, masturbation, family life, or common use of dishes. AIDS is transmitted by unprotected genital relationships, and for women the risk is higher. It is transmitted through blood and blood derivatives, with infected syringe exchange, direct contact between deep cutaneous injuries, contact between blood and mucosa, and uncontrolled transfusions. Even with AIDS, the infection is possible from mother to child during childbirth. AIDS can be diagnosed with a blood test that is free and the results are anonymous. AIDS stands for Acquired Immunodeficiency Syndrome, and it is caused by the HIV virus, and it is a permanent infection. AIDS is a syndrome, that is a group of different diseases that have the same origin, that is immunodeficiency. At the beginning, the symptoms are specific, like fever, fatigue, diarrhea, headache. Then it is asymptomatic for many years, and then there is weight loss, fatigue, diarrhea, fever, and persistent infection. To prevent AIDS, you have to use a condom. Alcohol and drugs do not improve sexual performances. And now we talk about genital mutilation. With genital feminine mutilation, we mean all the partial or total removal of feminine genitals for cultural reasons or other reasons that are not therapeutical. Genital mutilation can be done at variable ages: in neonatal age, during childhood, during puberty, before the wedding, after the wedding, during the pregnancy, or post-mortem. It can be done with different instruments, like blade, glass, can, or stones. Who does the mutilation? Usually a midwife called Eldaida and an auxiliary nurse called Tamageya. There are unfounded motivations for genital mutilation, like the assurance of chastity and fidelity, the assurance of the paternity, rite of initiation, aesthetical and hygienic reasons, healing from sexual disorders. The genital mutilation is seen as fundamental for the sexual identity, but is not related to religion. The results are the deprivation of dignity, autonomy, of value, of independence, autodetermination, and cultural evolution. It can cause many complications. Some are immediate and some are late. The immediate ones are death, hemorrhage, shock, urinary retention, infections, injury, and pain. The late ones are abscesses, cysts, birth complications, psychological effects, sexual effects, infertility, and the risk of HIV increases. It is a violation of the fundamental rights. From July 2006, in Italy, there are rules regarding the prevention and prohibition of the genital mutilation. UNICEF considers the genital mutilation like a violation of the women's right and violation of the right to health. To abandon the practice doesn't mean to abandon the aspect of your culture. Thank you so much for the attention.